Hi, I'm Crystal Dingler, Mayor of City of Ocean Shores. Thank you for tuning in to us. We're putting on a little video today because we have a lot of news to discuss, and I really wanted to get it out there as quickly as possible rather than waiting until the Wednesday for our radio show. So I want to start off with the governor this last week had some new things for us. We already knew that there was going to be golf starting next week and freshwater fishing and a few things like that, but we didn't know some of the other things that he was going to do. One of which was to name Grays Harbor County as one of the counties that gets to accelerate opening their businesses because we haven't had any new coronavirus cases in the last 3 weeks. And I think we made it by 1 or 2 days. That sounds really good until you get down to sort of the nitty-gritty of it, and it's a very difficult bar to reach. So I went out to the county website and I talked to the county commissioner because it is done at the county level. It's not something the city can do, though I certainly offered that we would help in any way we could to help put information together. But what it says is that you have to reach these certain levels. One of them is healthcare system readiness to provide care, including critical care for a large number of people in a short period of time. This includes availability of adequate beds, ventilators, and PPE. Now, what a large number of people is, I'm not sure, but I know that we have limited PPE. We don't actually have enough for our needs now. And I know that we have just very few ventilators. So it would be an effort for the county to come up to scratch on that one. The next one is enough supplies, and they mentioned PPE again. And then personnel to immediately test everyone with COVID-19 symptoms and those with high-risk exposures. Now, we have not had enough tests in the county, so there's another barrier. The next one is enough trained staff and volunteers to rapidly isolate people with COVID-19, support their needs while they are in isolation, and trace and support quarantine in their close contacts. And we certainly have trained staff, and I believe they have some volunteers that are working in the county level, helping with isolating people, and they have a plan, and they're doing very well on that one. But the trace and support in particular is going to be difficult because tracing people requires a lot of effort. We've seen on television people talking about that, and it takes a lot to do that. And if you had a large outbreak, which I'm assuming they're coming back to, so that's a difficulty. And then the next one is enough personnel, PPE, testing equipment to rapidly respond to outbreaks in congregate living situations, such as long-term care facilities and homeless shelters. And so we have several long-term care facilities in the county, and we know that there are homeless people in shelters and living out. So there are some really big things for us to overcome to do that. Another one of the things the governor said is that he did not anticipate any of these steps or phases that we're going through to happen closer together than 3 weeks, from moving from one phase to the next, except in these circumstances. And this seems like a difficult circumstance for the county to overcome. So in talking to them, they had some things that they were concerned about. And they talked about their incident management team, which is staffed by local public health, public safety, healthcare, and emergency response personnel. And those activities are directed by the Grays Harbor COVID-19 Policy Group. And that's composed of Sheriff Rick Scott, County Commissioner Vicki Rains, Grays Harbor County Health Officer Dr. John Boucher, Health Director Carolyn Holden, and Prosecuting Attorney Norma Tollitson. So it's an interesting group. I don't know how these are made up. I'm assuming they pick someone from law enforcement and healthcare and prosecuting attorney to kind of cover all of their bases. In any case, they are directing the incident management team, and they're working on all of these things. So when I met Saturday with the other mayors, and of course we met via Zoom, we talked about a lot of things, and one of them is, what are we wanting to do? And everybody wants to move up to level 2. Aberdeen obviously wants to get car sales going again. That's a big deal for them. Other places have other things that they want to get started, and everybody wants their small businesses to be able to open and not to fail. And so they're trying to think of how to open and that sort of thing. So I feel for us that we need to put a team of people together, and I will identify those folks next time we talk. And that team will work on how do we begin opening our businesses up. And of course we can't do that until we're given the green light. But we can plan ahead, we can figure out what the businesses need to be doing. Do we want them to open up? For instance, do we want a restaurant to open up completely? Do we want them to open up maybe a quarter business and have spacing? There's a lot of things that a lot of different places are doing out there, and we need to educate ourselves on those things and try to have consistent things for all of our restaurants to deal with. I got a call from one of the restaurants. They wanted to open on Mother's Day, and I can't give them permission to do that. This is a governor's order closing the businesses. I suggested that they might want to do a special takeout dinner or something like that, but they can't have people in the restaurant. So we're trying to figure those things out. At the same time, we have this other thing where we've kind of been given a carrot because we did a really great job of social distancing and doing all the things we're supposed to, and we didn't have very many cases here. But it's going to be difficult, and it's not going to be just overnight by any means. So those are the things that we're talking about and thinking about. And the final statement that the policy group in Grays Harbor said was that they will continue to closely monitor local capacity and readiness to respond to the increased transmission of COVID-19 that may occur if social distancing measures are relaxed. And I thought it was interesting that they said social distancing measures relaxed, because I don't think any of us are thinking about that happening. I think we all want to see social distancing kept in place, because that's really what has protected us. I also think that we need to wear masks, and I think a mask can be as easy as having, something like this across your face. I think it doesn't have to be a big thing, because it's a cough catcher. And it keeps you, if you're coughing, it keeps you from broadcasting that. And if that's what you're doing, if you have COVID, you can spread it to a lot of people very quickly. So this is really something that we need to think about and make sure that we do as we go into our public places. And it's interesting, I've had several people ask me, well, what you're saying, private places, do I have to wear this at home? And obviously, no, you don't have to wear it at home. But what we're talking about is those sort of halfway public private places, stairwells in condominiums. Those are not open to the public. They're for the use of the tenants, but they're not public property, they're private property. So that's really the kind of thing we're talking about, is making sure that you protect yourself, particularly when many of the condominiums have people who live out of town and they come to their condo infrequently, or they send relatives or whatever. So those are the things we really need to work on. And to me, the biggest thing about wearing a mask and keeping social distancing is in place is that we are going to see thousands and thousands and thousands of people this summer. They're going to come. And I don't know if they'll come in hundreds of thousands, but they will nevertheless, there'll be a lot of people coming in, and of all those people, some of them are not going to be well, and they're going to have the virus and perhaps bring it with them inadvertently, because you don't necessarily know if you've got it. So we need to protect ourselves. And if we put a mask rule in place so that everybody has to wear a mask, it means I wear a mask. I'm from here. I probably don't have the COVID virus because I haven't been anyplace else. But somebody coming in also has to wear a mask, and that protects me. So by me doing that, they do that. We're all the same. Nobody's being discriminated against. So I think it's really important that we think about those things and that we do everything we can to protect ourselves and our community. So I have some questions that were posed to me, and I will talk a little bit about those as well. Let's see. Okay, here's the questions. Certain recreational facilities and properties have been or will be opened by the governor, while others not so open shall remain closed. That's a statement that was part of the emergency order number 13. And what I'm saying is, I don't know which properties are going to be open. At least I didn't when I wrote this. I know better now. We had thought that Damon Point would be open, and it will not. We had thought that the state parks would be open to day use. They have decided not to do that on the coast. So basically the coast stays pretty much closed. I had hoped to open our beach access roads so that people could easily drive in and out. But it turned out, because these other things are going to remain closed, which we didn't know when I first thought we could open, because of that, we would be the only ones on the coast that would be open. And that just would not be a good thing. We would just be funneling everybody into Ocean Shores, and it would be a mess. And we'd make the news again in all the wrong ways. And we don't want that kind of situation. We want to kind of open slowly and have people come and understand that they have to do the right things while they're here. So the next question had to do with, please walk us through the timeline and process that had you informing council on 4/29 that beach approaches would be open, but ultimately led to EO 13. EO 13 is the rule that again closed the beach approaches. And I made it indefinite because honestly, I'm a little frustrated with having to extend and extend and extend, because we're not in control of what's happening. We are, sort of at the end of the food chain, and we have to just do what others want to do. And in this case, for us, the county wanted to keep their beach approaches closed, so us opening up would not be a good thing. And in fact, it turned out that Pacific County decided to keep their beach approaches closed as well, so all up and down the coast, they are closed. So that will keep many people from coming to the coast. Now, that's a good thing in some ways. In other ways, I really think we've got to start getting a handle on how to have people and make it work for all of us. So we'll come up with some ideas on how that can happen, and we'll float them out to the county and to others. But I think it's necessary, rather than just not doing anything and then suddenly we have a flood of people and we don't know how to handle them. So I think it'll be a good thing if we come up with something. And if you have some ideas, absolutely send them to me. All right. Some have commented that they like no vehicles on the beach. I got a call like that today. Don't we normally have part of the beach closed to vehicles 4/15 to Labor Day? And the answer is yes, we do normally have that. And that's something that state parks does is close that section, partly because they don't want people driving on the clam beds, and partly I think they just kind of want to give the beach a rest. And I assume that those signs are out there, though there are no vehicles on the beach. So if we open the beach up this summer, at some point we will still have sections that are closed. Okay. Oh, this is a tough one. The closure of beach access to motor vehicles has meant that some disabled residents effectively cannot go to the beach, at least for now. And I know that. I've gotten calls from people and emails, and I'm sympathetic. But if we let some people drive out on the beach, others are going to see cars and they're going to say, why can't I? And it's just going to tumble into everybody being out there again. And it's not our decision to make. It has to be a group decision up and down the coast. So I apologize to those people who would like to go out. I have a whole litany of things that I would like to do. We're just going to have to wait. And it's, you know, I like going down to Damon Point and just sitting in the car and looking out. I think there's all sorts of things that we can do that work for us. They're maybe not our absolute favorite thing. But anyway, I know that we moved to the beach because we wanted to have access. And it's really frustrating not to have right now. But this too shall pass. Okay, let's see. Lifting curfew. Yes, I lifted curfew. We are done with that phase. We didn't really have problems that we thought we might have with burglaries and that sort of thing. A lot of the businesses kept somebody in their business part of the time. Some of the hotels, I think, had, well, I hate to say guards, but they had people who slept overnight in the hotel so that there was someone there. So there really were not the kinds of problems that we thought might occur, but you don't know until you go through it. We have had periods of a lot of burglaries here in the past. It just depends on who's in town and what their plan is to do. We talked about face masks. I'm a big believer in face masks, and I think they can be, honestly, you can just have something like this that goes across your face. It doesn't have to be some fancy thing. Anything just to be that cough catcher so that you're not broadcasting out, and most especially so people coming into town are not broadcasting all over us. So I think it's important. And people, there's a question about people having breathing difficulties and find it impossible to wear a mask. Well, of course they don't have to wear a mask. I can't imagine why anyone would think they would. And all they have to do is explain the difficulty. And we're fine with that. It's someone else, you know, people have asked me these very specific questions about the rules and what constitutes this and what constitutes that. What we're saying is, generally speaking, everybody needs to wear a mask. And you know, you can't mask a baby or even a small child. You're not going to keep it on them. There are just all sorts of little exceptions. But by and large, we need to do this. We need to protect ourselves from those thousands and thousands who might come and bring who knows what with them. Okay, how will non-residents know they need to wear masks here? And that's really a case of signage, and it could be putting up on you know, your electronic board out in front of a business, or just something in the window to let people know. It's common in a lot of areas now. It's not so common in Washington. I'm not sure why, but it's something that we need to do. And by the way, I think everybody must know that we are still having 200 new cases of coronavirus in Washington every single day. So there is a lot going on out there away from us, and some of it will be coming our direction, but we need to be smart and we need to protect ourselves, and that will be a big part of how we survive through this. Let's see. Okay. Oh, the traffic numbers. Traffic numbers have been really interesting. We had what we would have called a good winter. January and February, we had a lot of people coming in, and that was great. And we appreciated that, and I'm sure the businesses did too, especially now that they're closed. Every dime they made then is helpful. In March, we still had fairly high numbers. We had, 75 to 84% of, on the weekends, of the normal traffic that we have, and that's way too much. But in April, it started dwindling off, and people slowed down their coming. So by the end of April, we were at about 40%, which is really great average for the whole month. And that means that it was even less part of the time. So I really appreciate that a lot of people are staying home. People are calling me asking if they can come to their second homes. And I'm saying, we have a rule in place that's put down by the governor that they should not. And as long as that rule is in place, that they should not be traveling except for very specific, very narrow range of immediate needs they have, we are going to enforce that to the extent that we can. So it's not made people very happy, but I think it's something that, again, we have to do. We are required by law to enforce the governor's edicts, and we do our best to do that. We have a small police force, and they are stretched really thin doing the normal things and then doing things like that as well. But it's important that we think about those things, and I'm certainly not going to give people permission to break the law. Okay, can we get any help from the state on keeping public restrooms sanitized, etc.? Well, we are opening up public restrooms, partly because we have noted that there are people who are using our great outdoors as restrooms. So we need to do something about that. We will bring in Santa cans in a lot of areas, and State Parks tells us that they will start keeping up the 2 restrooms, one at Chance and one on Damon Road, that they normally keep up. I think we're all going to have to put that essentially say you're going to use this at your own risk, because we can only clean so often. We cannot be there every time. We'll do our best to put out sanitizer, hand sanitizer, and that sort of thing. But you know, we've had incidents in the past where people just sort of rip those things off. So there you are. We'll do the best we can to make sure that those restrooms are fresh and ready and safe for people, but we can't guarantee that. All right, and how much is this impacting tourism dollars for the convention center? Well, the convention center budget was based on normal activity. So there's a fair amount of income that comes in with that activity, and it's not happening. So there is 0 income there right now. So we started laying people off. We gave notice, and we're required under the union contracts to give 30 days notice. We did that, and we laid off people as of the 30th of April. So we had, I think it was 13 people that we laid off, FTEs. So that it actually was more people than that, because there were a number of part-time people. So we also are not having our summer employees that would normally come in and help us with mowing the grass and doing all those things. And we're not filling any positions that are empty right now. Altogether, with the people that we laid off and their temporary layoffs, we're hoping to bring them back as soon as whatever part of the business they're working in, as soon as it needs them again, we hope they'll come back. Library, with library closed, we cannot continue to keep librarians paid. They have to go out and get unemployment. The convention center, those are the two big ones that lost people. But in other areas, we cut people back to anywhere between 50 and 80% of their, or 90% of their normal work hours. That means they don't get paid as much. That puts a hardship on families. And altogether, it's about half of our employees, or just under half, that were affected. I think it's a really tough thing for everybody, but I think that they all understand that we're just not bringing in as much money as we were. We're not bringing as much money in for water because, or for, sorry, sewer. We provide services for the casino, for the school, the high school out there. We provide those services, and for the hotels, water and sewer. Some are paying, some are not able to. So there's just this whole litany of different pots of money that aren't being refilled. So we're being really careful. We're not doing any extraneous spending, any project that is not absolutely necessary unless we have commitments already. It's just not going to happen probably this year. Maybe in the fall if things are better, but if things are better, there'll be a big scramble of everybody trying to do things, and the prices will probably go up. So that's not so good either. But if it can wait until next year, it will wait, and we'll just do our best on those things. Let's see. I think that's about everything. Oh, the status of the meal program. We are continuing with the meals program out of the convention center, and we're not making those meals from scratch. We're bringing food in and packaging the meals to go out so that then the CERT people deliver them to everybody. So that's something I wanted to keep in place, and I went to the council and they also wanted to keep in place. One of the council members even said that that was probably the most important thing that I, the mayor, had ever done. Well, I don't know if it's the most important thing I've ever done, but it means a lot to a lot of people who don't have to then go out and go grocery shopping, or who have lost their job and don't have the income to eat properly. People who don't eat properly get sick, so we don't want them getting sick either. So we're doing our best to do our part to help people and really make a difference for them, and I think that program is. All right, I think that's just about everything I have. Thank you so much for listening. If you listened clear through the end and you're listening to me now, we're doing our best to do everything we can to help you out and to keep you safe, but we also have to open up. We have to start making the changes. It's my intent to open the hotels. The 18th is the last day they will be closed officially, and I know that the governor's order is still in place then, but we just can't leave them closed any longer, and they need some time to start testing out. While they don't have very many people, they need to test out their procedures, and I'm working with some of the hoteliers and some other folks to kind of put some things together that they, are mostly suggestions that they can think about doing in their hotels that will help with this. So thank you very much, and I will talk to you again Wednesday at 9 o'clock. That's the new time that I have on the radio, KOSW, and I'll talk to you then. Take care. Bye-bye.